Good evening, students. So in this video we are going to discuss how thiazide diuretics like hydrochlorothiazide lead to hypocalciuria. It's a very important clinical point which every medical student should know, right? Now, for understanding how hydrochlorothiazide leads to hypocalciuria, we need to understand how exactly reabsorption of solutes happen in DCT. So, first of all, we will draw a cell of DCT, try to understand the reabsorption, and then we will try to understand how exactly hypocalciuria happens due to diuretics like hydrochlorothiazide, right? So let's first of all draw a cell of DCT, right? Okay, this is our cell. Now it has got two sides. One side is your basolectal side, means the side on which we have got blood vessels. Other side is the luminal side, means the side on which we have got the filtrate. The filtrate which will ultimately become urine, right? On this side we have got filtrate. On this side we have got blood vessels. Okay. Now the first thing we should know that what kind of ion channels, co-transporters we have got in DCT. In DCT we have got sodium chloride symporter. But which ion channel runs everything? Our main hero, the ion channel which runs everything is the same, sodium potassium ATPase. So first of all we'll draw sodium potassium ATPase over here. Right, it will pump sodium out and pump potassium in, right? Now if it is pumping sodium out, that means we will have less sodium inside, right? That means there will be gradient of sodium, means over here the sodium will be slightly higher compared to sodium inside, so there will be gradient of sodium, right? And that gradient will be used by your sodium chloride symporter, right? So up till now it is simple. We have got sodium potassium ATPase which pumps sodium out and pumps potassium in, which leads to less sodium inside the cell, and sodium chloride symporter uses this gradient, right? Now this chloride will escape through a chloride channel, right? And this potassium will also escape out through a potassium channel, right? But one very important channel we should know is this thing. We have got one sodium calcium exchanger, right? It uses the gradient, right? We have got less sodium here and higher sodium here. So the gradient of direction of sodium is this, right? Less sodium inside, more sodium outside. So gradient, the direction of the gradient of sodium is this, right? It uses the sodium gradient and uses that gradient to pumps calcium outside, right? It uses the gradient of sodium and pumps calcium outside, right? Now apart from that, we have got one channel called TRPV5, right? TRPV5, right? It helps in reabsorption of calcium from urine. It helps in reabsorption of calcium from urine, right? And of course this calcium is excreted out is reabsorbed with the help of sodium calcium exchanger, right? Any calcium which is left over here will be excreted out, right? Now everything is clear before you, right? We have got a sodium potassium pump, right, which pumps sodium outside, pumps potassium inside, which creates, which leads to less sodium inside the cell. Your sodium chloride importer uses this gradient to bring sodium and chloride together inside. Your sodium calcium exchanger uses this gradient to pump the calcium outside into the blood vessel, right? Now, everything is right there in front of you. Now, just think of it. Just think of it, what exactly the hydrochlorothiazide or thiazide diuretics are doing. Now, thiazide diuretics are going to block this channel, right? What thiazide diuretics will do? They are going to block this channel. Now, thiazide diuretics will block this channel, so this sodium and chloride won't be reabsorbed. This sodium and chloride will stay over here. Any place where you got more sodium, the water will follow and you will have excess urine which will be excreted out, right? The sodium and chloride channel, importer will be blocked. You will have a lot more sodium, lot more chloride which will get accumulated over here. It will bring lot more water and you will have a lot more urine, right? So the thiazide diuretic serves its function. But the main question which we have to answer is that how does it leads to hypocalciuria, less calcium in urine? Now just think of it. If this sodium chloride importer is blocked, right, then the sodium inside the cell will be further reduced, of course, right? If this ion channel is blocked, the sodium inside the cell will be further reduced. This means that the gradient of sodium, if you take from this instance, the gradient of sodium coming in this direction will actually increase, right? Now this sodium has reduced because this ion channel is blocked. Now the gradient of sodium will increase manifold this side. And which ion channel is using the gradient? This antipode is using the gradient. So you will have lot more sodium entering inside, right? And you will have lot more calcium going outside. Lot more sodium entering inside, lot more calcium going outside. So what it will lead to? It will lead to reduction in the level of calcium inside the cell, right? And if there is reduction in the level of calcium inside the cell, from where it will demand the extra calcium? It will demand the extra calcium from TRPV5 channel. And this extra calcium from urine will go inside the cell, which will be further go into the bloodstream with the help of sodium calcium exchanger, right? If extra calcium from the urine goes inside the cell, you will have less calcium in the urine, and this will lead to your hypocalciuria. Right? So hopefully this concept is clear. It's a very interesting concept. Lot of ion channels, lot of interaction, right? And this makes the subject of physiology and medicine so beautiful, right? That you understand mechanisms, right? You understand the intricacies, right? So let's discuss it once again. We have got this cell of DCT, right? It starts with our sodium potassium pump, which pumps sodium outside and pumps potassium inside. So this leads to less sodium inside the cell, right? Since there is less sodium inside the cell, the sodium chloride importer will use this gradient to pump both sodium and chloride inside, right? And apart from that, we have got one sodium calcium exchanger, right? It will use this gradient to pump sodium inside but pump calcium outside, right? Just in case when hydrochlorothiazide blocks this sodium calcium importer, right? There is sudden reduction of sodium inside the cell, right? Which increases the gradient from the basolateral side, right? If there is a lot more gradient of sodium from the basolateral side, means lot more sodium will come from this direction into this direction, right? That means a lot more calcium will be pumped outside. If a lot more calcium is pumped outside, you will have reduction of calcium inside the cell. Now the cell will ask for this extra calcium from urine through TRPV5 channel. When this extra calcium comes into the cell through this TRPV5 channel, you will have less calcium inside the urine, which will lead to hypocalciuria. So hopefully this concept is understood. Hopefully this video helped you in understanding this concept. Okay, wish you all the very best. Thank you.